St George's University of London. St George's University of London, legally St George's Hospital Medical School, informally St George's or ESCOL, is a university located in Tooting in South London and is a constituent college of the University of London. St George's has its origins in 1733 and was the second institution in England provide formal training courses for doctors after the University of Oxford. St George's affiliated with the University of London soon after the latter's establishment in 1836. St George's is closely affiliated to St George's Hospital and is one of the United Hospitals. History. St George's Hospital Medical School was originally established in 1733 as part of St George's Hospital at Hyde Park Corner, now the site of the Ladesborough Hotel in central London. The medical school was relocated, together with St George's Hospital, to Tooting, South London in 1980. A joint faculty with Kingston University, a Faculty of Health and Social Care Sciences, has increased the variety of allied healthcare courses offered at St George's, including nursing, physiotherapy, paramedic science, and radiography. St George's was the first institution in the United Kingdom to offer a 4-year graduate entry medicine degree based on the program from Flinders University, with which it has an exchange program. The first intake was in 2000 with 35 students, and the course has since been emulated by many other universities. Entry to the course is highly competitive, with candidates being required to sit the GAMSAT as part of the application process. In 2008, St George's announced that it planned to merge with Royal Holloway to form a single institution within the University of London. The merger was called off in a joint statement by the two colleges' principals on 25 September 2009. St George's intends to keep working with Royal Holloway in the field of health and social care, along with its well-established joint faculty with Kingston University. St George's, Kingston University, and Royal Holloway will continue to collaborate in the field of health and social care as part of the existing SWAN South West London Academic Network Healthcare Alliance. Campus. The St George's University of London campus is located in the Tooting area of South West London and is co-located with St George's Hospital, a 1,300-bed major trauma centre. Teaching facilities at the campus include clinical skills laboratories and a simulation suite allowing students to practice based on real-life situations, including surgical and medical emergencies. The university library houses approximately 42,000 books and subscribes to over 10,000 journals. Previously, the Rob Lowe Sports Centre, located at the St George's Hospital grounds, provided sporting facilities to students and staff, including a sports hall, 3 squash courts, and weights and fitness rooms. However, the site has recently been decommissioned, with only the sports hall retained. Students have used other facilities instead, including the nearby Tooting Leisure Centre. Courses. St George's offers foundation and undergraduate degrees at its site in Tooting in medical. In partnership with Kingston University, the Joint Faculty of Health and Social Care Sciences also offers degrees in physiotherapy, occupational therapy, paramedic science, nursing, midwifery, social work, and diagnostic or therapeutic radiography. St George's, in partnership with Into University Partners, has also formed a joint venture, Into ESCOL, to offer a foundation in medical, biomedical, and health sciences for international students whose qualifications do not allow direct progression into bachelor's level study in the UK, and a 6-year MBBS and a 4-year graduate stream MBBS program specifically for international students, with clinical placements overseas. The first student cohort on each international MBBS program entered St George's in September 2012. Outside of the UK, The MBBS4 is also offered in Nicosia, Cyprus, through a partnership between St. George's and the University of Nicosia. The new program was inaugurated and the first student cohort commenced in Nicosia in September 2011. The program at the University of Nicosia features international clinical placements in Israel and the USA. St. George's also offers numerous research and taught postgraduate degrees. Teaching. St. George's uses the integrated approach, which involves the use of both case-based learning (CBL), problem-based learning (PBL), and a traditional style of learning with the use of lectures and tutorials. The degree of PBL used in teaching varies between courses, for example, being a major part of the medicine graduate entry course but not prominently within the biomedical sciences curriculum. Anatomy is taught at St. George's through prosections and practical within the dissecting room, with anatomical dissection being optional as part of the summer dissection program. In the medical curriculum, preclinical teaching first and second year in the undergraduate stream, and first year in the graduate stream is largely based on lectures and tutorials held at the St. George's campus, with a few weeks' worth of attachments to various hospital departments. The third year of the undergraduate stream and second year of the graduate stream, also known as transitional T year, comprises 3 blocks of PBL with lectures and tutorials and 3 blocks of clinical placements in medicine, surgery, and general practice. Subsequent clinical years of either course are spent on clinical placements of various specialities, with teaching occurring as lecture weeks prior to each placement block, or teaching which occurs at hospital sites led by clinical staff. Clinical placements for students on medical degrees are mainly at St. George's Hospital and at other sites such as Kingston Hospital, Croydon University Hospital, St. Helier Hospital, and Epsom General Hospital. Other further sites, such as Frimley Park Hospital, St. Peter's Hospital, and Margate Hospital, are sites for placements during the later years of medical school. Student life. The St. George's Students' Union (SGSU) organizes various activities including fancy dress discos and a rag week, the annual series of fundraising events. In recent years, the union has become more politically aware and shown greater interest in National Union of Students and British Medical Association activities. Each new student at St. George's is assigned a mum or dad in the year above. These parents act as mentors for the new students, giving them advice about the course, often tutoring them when needed, as well as buying them drinks during Freshers' Week and beyond. Over the years, the family expands to include siblings, uncles, aunts, grandparents, etc., spanning all the years of the various courses. St. George's enters a team into the British television quiz program University Challenge each year and has previously excelled through the competition, especially in the field of medicine, unsurprisingly. Academic, cultural, and religious societies. There are several societies run by students at St. George's focused on several different aspects of academia, ranging from the Henry Gray Anatomical Society. Several clubs and societies cater to different segments of the student population, including cultural groups such as the Association of Chinese and British University Students Abacus, Afro-Caribbean Society or Arab Society. Religious groups include the Islamic Society and the Christian Union. Performance societies. Many student groups at St. George's produce yearly performances, mostly focused on dancing and singing. Some of these groups include the Diwali Show, Fashion Show, Tooting Show, St. George's Review, and the Musical Society. Sports clubs. St. George's Hospital Medical School (RFC) is one of the oldest rugby clubs in the world, having been founded in 1863. St. George's also has a number of other sports clubs, including Muay Thai, swimming, rowing, cheerleading, volleyball, fencing, football, netball, hockey, and many others, and participates in various competitions. As St. George's is a member of the United Hospitals, the teams also compete in separate competitions with the 5 other medical schools within the University of London and that of Imperial College. Halls of Residence. The university runs a Hall of Residence, Horton Halls, a large modern site which first opened to new students in late September 2007, replacing St. George's Grove. The old Hall of Residence. 1980s student applications controversy. In December 1986, it was discovered that a computer program used to process student applications at St. George's, written by Dr. Jeffrey Franklin in 1979, had discriminated against non-Caucasians and female candidates by deliberately reducing their likelihood of being offered an interview. A Commission for Racial Equality inquiry found that this unfairly deprived 60 candidates a year, as well as finding that various senior academics were aware that the program was discriminatory several times between 1982 and 1986. Notable people. Notable alumni. Notable alumni of St. George's include Joseph Adams, 1756–1818, English physician and surgeon. Sir Benjamin Collins Brodie, 1783–1862, English physiologist and surgeon who pioneered research into bone and joint disease. Henry Van Dyke Carter, 1831–1897, English anatomist, surgeon, and anatomical artist, most notable for his illustrations of the book Gray's Anatomy. Dr. Gabriel McGowan, 1999, English pediatrician. Walter Butler Cheadle, 1836–1910, English pediatrician. Sir Francis Darwin, 1848–1925, botanist, son of Charles Darwin. Sir John William Fisher, 1788–1876, English surgeon. Henry Gray, FRS, 1827–1861, English anatomist and surgeon, most notable for publishing the book Gray's Anatomy. Harry Hill, born 1964, English BAFTA award-winning comedian, author, and television presenter. John Hunter, 1728–1793, Scottish surgeon and anatomist. William Hunter, 1718–1783, Scottish anatomist and physician. Edward Jenner, FRS, 1749–1823, English scientist and the first doctor to introduce and study the smallpox vaccine. Nick Johnson, born 1970, Mayor of Cambridgeshire and Peterborough. Henry Bence Jones, 1813–1873, English physician, described Bence Jones protein. Francis Laking, 1847–1914, surgeon apothecary to Queen Victoria, physician in ordinary to King Edward Roman VII, and George V. Christine Lee, emeritus professor of hemophilia in the University of London. Henry Marsh, born 1950, world-renowned neurosurgeon. Keith McCarthy, born 1960, writer of crime fiction. Caroline Moore, UK first woman professor of urology, University College London. George Pearson, FRS, 1751–1858, physician, chemist, and early advocate of Jenner's cowpox vaccination. Paul Sinha, born 1970, Rose d'Or-winning broadcaster and stand-up comedian. Mike Stroud, born 1955, English physician and eminent explorer. Patrick Steptoe, 1913–1988, English obstetrician, gynecologist and pioneer of fertility treatment. Responsible for developing in vitro fertilization. Sir Patrick Vallance, born 1960, Government Chief Scientific Advisor GCSA and head of the Government Science and Engineering GSE profession. David Webb, born 1953, Clinical Vice President, British Pharmacological Society Vice President, Royal College of Physicians of Edinburgh. Edward Adrian Wilson, 1872–1912, English polar explorer, physician, naturalist, painter, and ornithologist. Thomas Young, 1773–1829, English polymath. Principals/Deans. Jenny Hyam since 2015. Peter Copeland, 2008–2015. Michael Farthing, 2003–2007. Sir Robert Boyd, 1996–2003. Sir William Astor, 1988–1996. Richard J. West, 1982–1987. Robert Lowe, 1971–1982. Alastair Hunter, 1956–1971.